Now, when we move to the lower eyelid area, this is the most complicated part of the anti-aging, anti-premature aging, and also just natural changes that everyone sees at every age group that we need to address, and understanding whether or not a cream or a topical could actually achieve a result here. When we talk about the lower eyelid skin, we need to differentiate between that portion of the eyelid that hugs the eyeball. That would be that thin-skinned area that is rounded out, and it tends to hug the eyeball as you open and close your eyes. That's followed by the infraorbital sulcus, which is this area right along the lower eyelid where it meets the cheek, and you can actually feel the bony margin of your cheek right underneath there. And there's a little bit of a sulcus there, or a depression in the skin, which is natural because this is an area where you go from a thinner skin portion of your anatomy where there's no bony support underneath it, your eyeballs underneath there, to the bony structure below that. Because of that difference in the tension on the skin underlying it, you will naturally see a step off in the skin in that area. But let's talk about the things that people notice and what they ask us about, so that you can decide where a cream or a topical, again, a procedure, might play a role. So probably the number one thing people ask about would be darkness under the eyes. So that would be dark circles under the eyes. Now, defining what that dark circle is again essential to figuring out which interventions we can do. So there's multiple ways that we can see dark circles. One would be that we just have less hydration under the eyes, and this can be seen from not drinking enough fluids. It could be from poor sleep habits where there's an element of dehydration, where that volume under the eyes gets depleted, the natural volume, and some of that is just fluid volume because the soft tissue around the eyes is like a sponge and it holds on to moisture. If it does not have that moisture from within, then yes, it's going to appear sunken in. So if you do feel like you're seeing dark circles, first we need to evaluate why. If this is a new thing, meaning you did not have them your whole life, then there's a chance that there might be something dietary-wise, lifestyle-wise that we need to consider, because if you don't address those aspects, you can use all the creams in the world, but you're going to still feel like there's some evidence of it there, because they're only restoring volume on the surface of the skin and the epidermis and the very superficial layers of the epidermis, but the volume loss that you're experiencing that can lead to sunken in eyes is much deeper than that. So we need to make sure that you're hydrating, sleeping well, understanding the role that each of those factors plays, so that you can be one step ahead of reversing or preventing them in the future. Now, the second reason people will see dark circles under their eyes could be a genetic tendency towards something we refer to as periorbital hyperpigmentation. This is something that's an inherited trait where some people just naturally start to develop pigment around their eyes. The way that I tend to evaluate this to tell the difference, or explain to my patients to evaluate it, is to simply stretch the eyelid skin apart. And when you stretch the eyelid skin apart, if you can actually get that discoloration to disappear, it's probably not an inherent part of the surface of the skin. However, when you stretch that skin apart, if you can see a dark sort of pigmentation extending from along that infraorbital sulcus, then there is a chance that that pigment being deposited in that skin could be an inherited tendency, or it could be secondarily to some allergies and other types of swelling that's left behind pigmentation when it comes and goes. So some people can just get pigment deposited from swelling as well. So we need to figure out why that pigment is there in the first place. With periorbital hyperpigmentation, if you look at parents and grandparents, siblings, and other relatives, if they tend to have, and perhaps from a very early age, because I can even see this developing in teenage years in many of my patients, it can be really, really challenging to address, because some of that pigment is really hard to reverse once it's there. Sometimes we'll try bleaching creams and other types of products to try to lighten this up. It can be hard to prevent if you have a strong tendency towards it, other than recognizing the role that photoprotection can play in reducing your tendency towards this. So recognizing that pigment tends to deposit in our skin often as a result of photo sources. And when I say photo, we're not just talking about sunlight, we're talking about indoor lights, visible light, and blue light. So we want to make sure that people are taking measures to protect that skin from pigmentation really settling in over time, and then talking to your dermatologist about different types of topicals and products that we could try to use to try to fade it over time. It would be really hard for some over-the-counters to achieve this, only because many of the products that are out there are really designed to prevent pigmentation from depositing from light sources, but not necessarily remove it once it's there. Now, the other reason you can see dark circles under the eyes is because the thin skin around the eyes as we're getting older does become thinner, and you can actually almost see the translucent quality to the skin, which allows you to see the muscle underneath the skin. If we really do find that the skin is so thin that you can actually almost see right through it, this is again an area where products may help improve the turgor or hydration of the skin to perhaps make the seam a little less apparent, but they are only going to get so far. This is where you really want to talk to your dermatologist about sometimes interventions that we can do in terms of lasers or other types of procedures to thicken the skin, or even adding volume under the skin so that that sunken in quality does not lead to a pigmentary problem that you see over time. Now, if you have a tendency to rub your eyes quite a bit, have allergies, or are allergy prone, it is also common because of the vascular component and congestion around the eyes for some people to see dark circles under their eyes as well. If this is the case and you tend to rub your eyes a lot, where you might even have thickening of the skin around the eyes that leads to pigmentation, or you have a tendency towards allergies that leaves behind puffiness at times that comes and goes or fluctuates and tends to leave pigmentation behind, we have to often address the underlying conditions that trigger those types of changes in the skin, and just using another cream over the counter might struggle because they can't really address the underlying cause for those challenges. The other most common complaint we hear about under the eyes would be puffiness under the eyes. Puffiness is actually when people have, it's not that they see dark circles, they actually feel like there's added puffiness, usually on the lower eyelid skin that bulges outwards, and then there is that sulcus, that infraorbital sulcus, where it defines it better before you get to the cheeks. So a lot of times what you'll find is that puffiness accentuates that eyelid skin. Oftentimes the puffiness under the eyes is a result of fluid deposition, and the question really becomes why. Is there an allergy component to this? Is there any fluid backup as a result of nasal congestion or sinus congestion that could be contributing to it? Now, it is possible for creams to help address some aspects of this, as some ingredients in different creams can sometimes improve or reduce the inflammatory component of that skin, but choosing the right cream is essential. Now, differentiating the type of puffiness that you have under the eyes is essential, because there are actually two types of puffiness we can come across. One would be when you have just added fluid or added sort of fullness to the lower eyelid itself. So just the lower eyelid, the part that hugs the eyeball, feels a little fuller, versus that area underneath the eye feels a little more sunken in, relatively speaking, to that lower eyelid skin. There's likely fluid deposition in that soft tissue under the eyes, which could be the result of a variety of factors, ranging from allergies to crying and other things that we need to consider. That not only can we use some creams to help reduce that puffiness, but we also have to address the why of this. Meaning, if you have a strong tendency towards allergies, sinus congestion, you cry at times, meaning you find that you are very tearful, or your eyes are tearful just because you have chronic irritation in your eyes. All of these can contribute to puffiness as well. So yes, we can reduce some of the puffiness with the cream, but we also want to get to the underlying trigger. However, if the puffiness that you're experiencing under the eyes is not limited to the eyelid skin, the part that's hugging the eyeball, but is actually in that little depression between the eyelid and the infraorbital sulcus, and it feels like a fullness, there's a good chance that there's a fat pad underneath there that is herniated through from behind the eyeball as we get older. This is something that can happen as we get older, and it can be an inherited tendency as well that might run in some families. Now, this is something that a cream cannot help, and this is something that many people do come in asking about and have tried various types of creams. These creams cannot structurally remove that fat pad from under the eye, so you're not going to be met with a lot of success. The creams that some people have used, there's some creams that use silicates in them, which are meant to tighten the skin temporarily above that pad, because then maybe that sort of crepe-like quality of the skin may not be as apparent. But again, it's only a temporary result, not a permanent result. Now, if that infraorbital fat pad does bother you, it's not something a cream can remove. It's something that might need to consider surgical intervention for. So please keep in mind that this should be evaluated before wasting a lot of money on another product, because it's hard to say how effective they could be if this diagnosis is not made correctly. Now, the next thing that most people will complain about under the eyes is the crepe-like quality to the skin under the eyes, and it's something that can be really, really challenging to address. This is a muscular contraction of the eye that is very noticeable as we get older, only because, again, the skin thins and makes it more apparent over time. So there's less volume supporting the skin, and the skin itself is thinner, and then you see that muscular contraction when we squint contributing to it. This is something that sometimes some skin tightening devices, such as radiofrequency skin tightening, can help to address, as well as sunscreen, sunglasses, to reduce the tendency towards it as we get older. And it can be a challenging area to apply retinols or other products simply because that skin is very, very sensitive overall. But it is also an area that sometimes when we inject neurotoxins like Botox around the outer eyelid, by relaxing that portion of the muscles, sometimes that area under the eyes is not as apparent. So we can soften it, but we can't necessarily get rid of it entirely. If it really is something that starts to bug you, sometimes surgical interventions are best, only because by removing the laxity of the skin and tightening it up, it can improve the overall quality. That crepe-like quality is really a result of the elasticity that's been lost over time. That creams can again improve the turgor or appearance of the skin temporarily, but not necessarily reverse. So this is something to talk to your doctor about. Sometimes skin tightening devices or procedural interventions that could help improve the quality of that skin as you get older. Now, the other thing to bear in mind when it comes to the area around the eyes that people will start to notice is that we actually do lose some cheek volume over time. As the bony structure of the central face does start to thin out as we get older, area right along the cheek where we call it the tear trough area, it's the area that extends from the medial eye right down the middle of the cheek, can start to look more sunken in. This could give the appearance of looking more tired or fatigued. However, it may not be that you actually are tired or fatigued. It's a change in the structural anatomy of our face. When that occurs, it falls into the category of being a loss of volume. So it is an area that we will often intervene, not necessarily under the eyelids directly, but actually restoring the mid-face cheek volume. By adding in volume in that mid-cheek area, what we will find is just by pulling out the skin and restructuring it, we can actually find that the lower eyelid skin does tend to benefit from that intervention. Again, this is something that a cream or a product could not achieve because it's a structural change in your anatomy as we get older that a product could not necessarily reverse. All we can do is try to reduce our tendency towards skin changes on the surface through things like sunscreen use, photoprotection, as well as potentially retinol-containing products, and even potentially retinol or prescription retinoids to try to reduce our tendency towards that collagen breakdown over time on the surface. Again, those won't necessarily change the bony structure of our facial anatomy, and that's something that we often have to intervene with. Understanding the actual normal anatomy is essential when you find a physician to help intervene there, only because if the placement of that filler is not appropriate, it can alter your appearance. The key to getting the best outcomes is to understand that this is what we qualify as restorative cosmetics, not transformative cosmetics. If you never really had cheekbones before and then you go to seek them, then yes, you will look and appear different than before. However, if you naturally had a contour to your cheek that you've noticed has changed over time and actually starting to secondarily impact how your eyes appear, then actually restoring that volume to where it was before can actually give you that appearance of feeling well rested, less fatigued, but not look like your appearance is altered. You don't look like somebody else, because most of my patients, I've been working outside of the Philadelphia region for almost 20 years. I find that most of my patients aren't looking to transform their looks. They're looking to restore their appearance. They're more looking for what we refer to as restorative cosmetics and things that make them look like they're better rested, and they're really looking to look like themselves and better rested and a better version of themselves as opposed to looking like somebody else. What we find when you intervene in that capacity, it's very hard for people to figure out if you even had anything done, simply because what they're seeing is your natural contours as opposed to altering your facial appearance.